In today's video, I'm going to show you how you can treat IT band syndrome at home. Welcome back to the channel. If you're new here, my name is Todd Sullivan. I'm a chiropractor who specializes in relieving pain and muscular injuries. I treat a wide variety of running injuries, and one common injury we treat in our office is IT band syndrome. Now, what causes IT band syndrome is that when there's overuse of the thigh muscles from, say, running longer distance, doing a high volume of training, or walking longer distances if your body's not used to this. The quadricep muscles, the IT band, and the hamstring can get very tight, and it puts a lot of pressure on the IT band and can cause pain and inflammation. It can also cause clicking on the outside of the knee. So if you hear a repetitive click every time you're bending a knee, it could be the IT band that's become really tight and painful. So the key to treating IT band syndrome is you have to loosen up the IT band, take the pressure off the tendon where it attaches on the knee, and your pain will go away. So what I'm going to do is I'm going to show you 3 ways you can treat IT band syndrome at home. To treat IT band syndrome at home, the first way we're going to treat it is to use a massage gun. The IT band is a very strong, fibrous, flat tissue that goes on top of the quadricep. So when you're using a massage gun at home, you want to treat the quadriceps, the actual IT band, and the hamstrings below. The most important portion of the quadriceps you're going to want to treat is the rectus femoris, which is this muscle right on top that attaches to the top of your hip and then comes over and attaches in the front of the knee. Then you're going to treat the vastus lateralis, which is this portion of the quadricep muscle. And again, this part of the quad extends underneath the IT band to the back of the lateral hamstring. Now, to treat the IT band with the massage gun, I'm going to put it on the lowest setting, and I'm going to use either the round head or the flat silver dollar size head. If you go with any of the pointier heads, it's going to feel very uncomfortable. And if you're dealing with any pain and swelling in the knee, that's going to be unbearable to work that IT band. The 2 massage guns I really like are going to be the Bob and Brad C2 massage gun that you can purchase on Amazon, or the Hypervolt Go 2. That's going to be another affordable product. It runs about $120, $130. Both of those are really good massage guns that I use all the time in the office and that I highly recommend. I'll leave a link to those 2 massage guns in the description below. So the Bob and Brad massage gun has 5 different levels. I'm going to use either level 1 or level 2, but this is going to just depend on how tight you are and how much pain and discomfort you're in. So what I'm going to do is I'm going to work this middle portion of the quadricep called the rectus femoris. Just going to go up and down, find any of these tender spots, concentrate on any spot that I feel where I have any knots or trigger points, and then move on to the next one. And this typically takes anywhere from 30 seconds to a minute. And then I'm going to move on to the vastus lateralis. This is, again, is the biggest portion of the quadricep and often the main problem of IT band syndrome. And if you can imagine, the vastus lateralis is in between the top portion of your thigh and the actual IT band. And it's going to span this region right along the seam of your pant. And again, it's going to go up underneath the IT band. So we're going to work this whole area. And you'll often find lots of different knots and trigger points in this area. And some of the spots are going to be very tender as you work them. And again, I'm going to find a spot right here on me that's tight, typically about 4 inches above the knee. And this vastus is a common trigger point we'll see. But again, it may be different for you. So just go up and down, find any of those spots, and then work them back and forth. If I find a spot like right there, I'm going to hold it and work it back and forth, and then move on to next. What I'm going to do is I'm actually going to work the IT band itself. So again, I'm going to kind of treat through the IT band to the quad muscle that goes below it, and go up and down. Again, be careful as you get towards the knee. It's going to become very sensitive when you're treating IT band syndrome. The issue will go away pretty quickly. Within a week or 2, if you're consistently using it, it'll help to loosen this up. Once you get out of the acute pain, then I would recommend you do it every other day, and then start spreading it out as you feel better and looser. Once we treat the IT band syndrome, the next area I want patients to treat is going to be the glute muscle. So the glute muscle is a hip stability muscle. So every time you're stepping or walking, that glute muscle is weak or tight, it's going to put extra pressure on the IT band. So to work the glute muscle, all you're going to do is turn on your device, and again, work all along the posterior part, upper glute area, again, from this greater trochanter up, and then to the posterior part here. And you're going to find some tender spots. Again, every time we're stepping and running, this muscle is activating. And if it's weak or tight, it's going to be sensitive. And you're going to want to work that spot in and out, find any spot, work it for anywhere from 30 seconds to a minute, and then go on to the other side. The final area I want you to work is going to be your lateral hamstring. So a lot of times with IT band syndrome, this is also going to be very sensitive and tight. And so all I'm going to do is work up and down along this posterior part The hamstring butts right up against the IT band. So where the quadricep meets with the IT band and then the hamstring, a lot of times where there's those 2 points, there's a friction between the two. And the IT band doesn't slide over the quadricep or the hamstring. So by working that seam, that will help the mobility of the IT band. The second way to treat IT band syndrome at home is to use cups. So a cupping technique is where we're going to apply the cups to the side of the IT band here, and we're going to use it on your quadriceps and hamstrings. And what it's going to do, it's going to draw the skin off of the IT band, increasing the blood flow to that tissue and kind of decompressing that IT band. A lot of times with IT band syndrome, you'll get a lot of pressure on that knee, and again, it's almost like that skin is kind of sucked down onto the IT band and there's a lack of mobility. And like I mentioned before, with the massage gun, you want to work that seam between the quadricep and the IT band and the hamstring and the IT band. A couple sets of cups that I like to use at home. One is called the Rock Pods. This is by the company that makes Rock Tape. Now to use the Rock Pods, what we're going to do is we're going to kind of twist it inside out, and once I have the area we want to treat, I'm going to flip the cup back on top of itself, and now it's really secure to the tissue. And again, what I can do is I can twist the cup, I can kind of pull it off, back and forth like that is what's going to help with the mobility of that tissue and help increase that blood flow. And this works really well. Again, I didn't have to use any kind of pump. I didn't have to use any other kind of products to help get that adhesion. It's really well, and it works really well in that area. Once I have the cups on the quadricep or the IT band, then all I'm going to do is I'm going to go through some range of motion with the cups on. And what we found is that helps to, again, increase that mobility and help loosen up that seam between the quadriceps and that IT band. It also increases the blood flow to that area and takes more pressure off that area. Now, all I need to do to remove the cup is just put my finger underneath and then take it off, and it's that simple. Now you will get those cupping marks, right? So in my case, they have a red circle over the problem spot there, but the cup marks will go away pretty quickly. Depending on your skin tone, it can last longer. Some people, it goes away within a day. Some people, it's 3 to 4 days. Sometimes for me, because I'm more light skinned, it'll last for 4 or 5 days. But it'll go away, and it doesn't cause any pain once you actually have the cup on, but you can see it increase the blood flow to that area, which is going to help to decrease your IT band syndrome pain. Now, besides the Rock Pods, the other thing you can do is you can purchase a cupping set on Amazon. So these range anywhere from $35 to $50. I'll put a link in the description below for the Rock Pods and this unit that you can buy on Amazon. But what this unit's going to do, it's going to come with several different types of plastic cups. And then it's also going to come with a hand pump. And the hand pump will help adhere the cup to your skin. It's very easy to use and it's very safe. Now to use the plastic cups, all we're going to do is we're going to put it onto the handle, and then we're going to place the cup where we want the treatment to occur, and then we're going to start the pumping. And you'll start to feel a really good pressure where the cup is adhered to the skin here. Now these plastic cups will create more pressure than the Rock Pods, but both are going to be very effective. And now with the cups attached to the IT band or the quadricep, what I'm going to do is I'm just going to kind of rotate the cup back and forth. And again, what that's doing, it's kind of shearing the tissue and helps to kind of break up any adhesions. And then I'm going to lightly kind of traction up and around the cup, and then I'm going to add some active motion into it. So again, I'm going to just go flexion and extension, flexion and extension. All I'm going to do is I'm going to add some motion into it. So I'm going to just go into flexion and extension. And when we're doing the actual IT band, when we're going through the range of motion, just go through the flexion and extension of those muscles, and that'll actually get a good pull, because again, remember the quadricep muscle goes up underneath the IT band. So when we flex and extend the knee, that's going to get the pressure relief on that IT band. When you leave it on for an extended period of time, up to 10 to 15 minutes, you'll notice that area gets very red. You'll get some purple-like color in there, and it creates some petechiae, like the stage before a bruise would occur. What I would typically do is I would place one above the knee, about 3 to 4 inches, one kind of beloda that greater trochanter. I also apply one right to the quad and to the hamstring as well. You're going to want to try using up to 4 cups. You can just use 2. You can play, again, more on that seam, more on the posterior seam. Just test it out and see what feels comfortable for you. And then once you're done, all you got to do is pull the release on that plastic cup, and then the cup is off. And you can see, again, there's a red welt in that area. It doesn't hurt or anything like that, but you can feel there's more warmth to the skin in that area. The blood flow is moving in that area, and that'll take your pressure off. One thing I noticed with cupping technique is there is immediate relief to the pressure on the injured area. So when we're talking about the IT band, again, almost like it's matted down to the skin, it's very taut. When you decompress it with the cups, there's actually more mobility. You'll notice you have more range of motion with less pain and discomfort. So a cupping technique is another great way to help relieve the pressure and to help heal IT band syndrome at home. The third way to treat your IT band syndrome at home is to use a kinesio tape. Now, like the Rock Tape brand for kinesio tape, you can also use KT tape, but what I find is the Rock Tape has a better adhesive and it lasts longer. And so Rock Tape comes in either a 2-inch version or a 4-inch version. The 4-inch version is great if you're treating the IT band, the quadricep, or hamstring, because it covers a broader range. Now, you could use the 2-inch version and just cut off 2 pieces and apply that on the IT band, but ideally I'd like to use the 4-inch version and just cover the whole region. Now, what we're gonna do is we're gonna anchor the Rock Tape to the greater trochanter, which again is this bump on the side of your upper femur, and then we're gonna go down the side of the IT band and attach it on the outside portion of the knee. And again, it's gonna provide some pressure relief on that IT band like the cupping just did, and it's just gonna support that knee, increase the blood flow to tissue, and help to decrease any pain or discomfort when you are running or walking. One thing I like about the Rock Tape is you barely feel it's on that area, but it's just enough support where it doesn't restrict your range of motion, but just takes that pressure relief off that area. The downside to Rock Tape is it's designed to be on for 3 to 6 days. So if you want that tape off, you do have to peel it off and then throw it away. You can't reuse it. So say I'm treating the IT band with the cups, you'd have to remove the kinesio tape, do the cups, and then reapply the kinesio tape on top of it. So ideally what I would do is I would do this in between treatments where I have 2 or 3 days in between the treatments. The other option is you could use an IT band strap, which is a Velcro strap, which goes above the knee. What the IT band strap does, it applies pressure to the IT band and it takes the pressure off that lateral portion of the knee. Essentially, when you put it above the knee, it acts as a new attachment point for the IT band. Instead of attaching down here, if you put it above your knee, it kind of acts as a new attachment point for the IT band. So what's nice about the IT band strap is you can remove it or you can apply it depending on what you need. So to apply Rock Tape, what we're going to do is we're going to cut a piece off. And again, we want to go from all the way here up to the greater trochanter. So you want to kind of measure that space out. Now there is going to be about 50% stretch of the middle of the tape. So if you go too long, it's going to be all the way down your leg or too high up. So you do got to kind of take in consideration some of that stretch. So once you get the hang of it, you'll know, okay, if I start down here, I'm going to have about 2 to 3 inches of stretch. And that's how you know you cut off the right amount. Once we cut off a piece, we're going to put the ends together, and what we want to do is we want to round the edges. Now by rounding the edges, what that's going to do, it's going to prevent the tape from either catching on your pants or your shorts and kind of coming off on the edges there. It helps it adhere better to the skin. Once we have the tape rounded on the edges, then what I'm going to do is I'm going to peel off the backing on this Rock Tape, and I'm going to start up here at my greater trochanter. So I'm going to apply about 30 to 50% of stretch onto the tape, and then once I get down to the knee, I'm going to apply no stretch, and then I'm just going to anchor it on the side of my knee where the IT band attaches. What we're going to do is we're going to peel off the backing, we're going to find the greater trochanter, and we're going to adhere the Rock Tape to my skin. Once you have it applied to your skin, you want to rub that attachment point. The friction from your fingers on the tape will adhere the glue to your skin. The glue on this tape is heat activated, so when you rub your fingers over it, it makes the tape adhere better to your skin. Now that we have it attached to the greater trochanter, what we're going to do is we're going to start to peel off some of the backing. Now what I'm going to do is I'm not going to touch the adhesive on the tape here. That'll help it adhere better to the skin. Now what I'm going to do is I'm going to apply about 30 to 50% of stretch, and then at the end I'm just going to peel it off and apply no stretch at the end. And now again, what I'm going to do, I'm going to rub my fingers over that kinesio tape, and that's going to help it adhere to the IT band. And what you want to do is you really want to rub the ends of the tape, so make sure it adheres really well to the skin, because that's the area where it's typically going to pull off of the skin. You can also use the backing of the tape and go up and down to help it adhere. Again, that will create that friction, which will make it stick. Now, for some people, they're gonna wanna apply that KT tape more to the quad side. Some people will need it more on the hamstring side, and some will like it here. But again, if you use that 4-inch version, you're gonna get that adherence to that whole area. So you're gonna get the seams on both sides and the IT band. And again, it's gonna attach really well around the knee. But the 2-inch version will work. And if you wanted to use 2 pieces of the 2-inch version, you could do that too. One here and then one here, and just make sure it adheres really well to the skin. Now, if you ever want to take it off, it just peels off like a Band-Aid. What I would recommend is after you've taken a hot shower, that's a great time when the tape is wet, you can just peel it right off. If the tape starts to come off on the edges, all you got to do again is rub your fingers over it, or you can run a hairdryer over that area, and again the heat will make it adhere better to the skin. But typically it'll last about 3 to 5 days. And again, this is why I like rock tape, because it works better for athletes and adheres better to the skin. Again, they offer that 4-inch version, which is really good for IT band issues, but the quality of the tape lasts longer, it feels better, it feels like a higher quality product. In the description, I'll leave a link to the rock tape that you can purchase online, both the 2-inch and the 4-inch version. You can purchase this on Amazon. This is a great product because you can use it on multiple different areas. You can use it on your lower back, you can use it on your elbow, your plantar fascia, your Achilles. It has lots of different uses, and there's videos online on my channel and others that show you how to apply it to different areas. So those are 3 ways that you can treat your IT band syndrome at home. Obviously, you can also ice the area. That works really well if you're dealing with an acute IT band. If the IT band is tight, what I would recommend in the belly of the muscle is to apply heat for 10 to 15 minutes. That can help to loosen it up. But use these 3 other methods at home to help treat your IT band syndrome. If you have any questions, leave a comment below and I'll try to answer them for you. To schedule an appointment online, go to novachirowellness.com. And if you want to learn how to treat other common running injuries, click or tap the screen to watch the next video.